Hello, for anybody who's watching this video back. So it's the peer support group for any patient with COPD, and we're just going to cover a bit of the guidance today regarding the new government guidance which has recently come out. On the call as well today, we've also got Dawn, who is a respiratory nurse. So as you may be aware, the new guidance came out on Sunday. So the new guidance is now stay alert. So this means that the new UK government guidance is now that you stay at home as much as possible, work from home if you can, limit contact with other people, keep your distance if you go out, so 2 metre apart from where possible, and wash your hands regularly. And if you or anybody else in your household have symptoms, you must self-isolate. So what does this mean for somebody with COPD? So as you may know, well, obviously you probably do because you might have received the letter, that those with COPD are at high risk, so they're critically vulnerable. So if you are high risk, you should have received a letter from the NHS. You might have received this recently or a few months ago. So to speak to your GP or hospital care team if you have not been contacted and you think you should have been. What this also means, if you're high risk from coronavirus, is that you're advised to take extra steps to protect yourself. So this includes not leaving your home for any reason, so that's called shielding. So as you may have known if you have received that shielding letter, so shielding means that you do stay at home at all times. You don't leave your home to buy food or to collect medicine. You stay at least 2 metres away from other people in your home as much as possible. Get food and medicine delivered to your door, ask family and friends to help, or if you do need to register online to get more support, you can do that on the Gov website. Prepare hospital bags, including lists of medicines you're taking in case you need to go to hospital. Wash your hands with soap and do it for 20 seconds. Make sure anybody who you come into contact who comes into your home washes their hands with soap for 20 seconds. So if you're living with someone, make sure if they come home, wash their hands. Use hand sanitizer. Clean your objects and surfaces as well as often as you can. And shared bathrooms, clean it each time you or the other person that you live with, etc. Clean it as soon as they've used it. If you're shielding, do not have visitors to your homes. This is including friends, family, unless they're providing essential care. So, for example, if you are living by yourself and you are shielding and you need somebody to drop off medicines to your doorstep, that's fine. Obviously, make sure they're dropping it off, they're walking away, then you're getting that, but you are disinfecting it and they've disinfected it before as well. And do not stop taking any prescriptions without speaking to your doctor first. So you can register for support on the Gov website, or you can call 0800 028 8327 to register, and you just need your NHS number with that. Or if you are suffering with coronavirus and you are shielding, you call 111 if you feel like you need some more guidance, or 999 if it's a critical emergency. Locally as well, you can also get help from the Doncaster hub, so that's 01302 43 300, or email enquiries@dncommunityhub.org.uk. Or if you want even more local support, you can contact the Well Doncaster at doncaster.gov.uk email as well. So like I mentioned, we have got Dawn on the line today, and Dawn's going to take you through some more in-depth details regarding shielding and the new government guidance. So I suppose I'll start with a question to you, Dawn. So I've actually had a friend of mine, her dad has got COPD, and he has a hospital appointment. His GP is telling him that he cannot leave the house, but then obviously he's got this hospital appointment. What would you advise, and what next steps should he take?
I think anybody who's got a clinic appointment should be contacting the clinic and asking, because some appointments are being converted to telephone appointments. So it may well be that they want them to keep that slot, but the consultant will ring them during that time frame. Some appointments, the risk is too great, so they may well say, no, this will be postponed and we'll move it on to another date. But certainly from a respiratory point of view, I know that our respiratory consultants are doing telephone consultations with a lot of our patients. So it depends on the appointment and what it's for, but I would always say ring whoever you know you've got the appointment from and ask their advice, and then they'll tell you. Some of the appointments are starting up again now. We've got through the worst of the crisis, so it may be that you know, they do need to attend, and there are certain things that you can't just do over the phone. So some screening is really important, but obviously it can't be done over the phone. So it's about having that conversation, and I think if you do have to go to an appointment, I think the key is go on time and not really early, because I know a lot of us try to get there really early. So I think go on time, so you're limiting your exposure in the waiting room. When you do get there, obviously washing your hands as soon as you get there. Try not to use public transport if you can help it, and literally, like I say, just get there just before the appointment, and try and distance yourself in the waiting room. So obviously put yourself 2 meters away from somebody else. They're being really good for patients that are going into clinic appointments. They are seeing them in quite a timely manner, so that they're not hanging around and putting them at risk. But like I say, every appointment's different, so it's better to ring just before and find out.
That's brilliant, thank you for that. And in terms of shielding, have you seen a difference in people who have received the letters early then rather than more recently? What advice would you give to people who have received the letters quite a while ago?
I think the main difficulty when we just had the update, they didn't straight away clarify what it meant when you'd got a shielding letter. And I think a lot of patients thought, well, I do my 12 weeks and then that's it, I can go back to normal. But sadly, that's not the case. So they currently have changed the advice to the shielding letter whenever it came. It may be 12 weeks, it may be more than 12 weeks, but for the moment, it's definitely until the end of June. Now, obviously, advice is changing day by day, so that may well change nearer to the time, but at the moment, it's definitely the 30th of June and not whatever date you've scheduled. So it's quite disappointing for some patients because they could see some light at the end of the tunnel, but it's really important that we continue protecting them. And you know, staying in wherever possible. And I think the new message about staying alert for everybody else is the key, but I think it's the stay at home for shielding patients. It's important.
Yeah, most definitely, and I agree with you. The word little mentioned about those who are shielding. So for anybody who because I know for myself that there's a gentleman who with mild COPD and he hasn't received a letter, so it's a bit confusing because obviously it's they've got COPD but they haven't received a letter, so they're even going back to work soon. And obviously people need to make sure that not only are they following by what they've been told to do, so if they have received a letter, shield, but also those who have got this condition who have been requested to go back to work, they also need to make sure that their employer is also following the guidance, because obviously they are still at high risk. Yes. As well. Yeah.
I think the clarity is in the degree of COPD, so we know through to the very severe. So not everybody with COPD will have got a shielding letter. It's only the ones that their disease is more progressed. But the advice is absolutely still the same. If you've got COPD, you are at a higher risk if you develop COVID. So the ones that are going back to work, it's very difficult. So some of the conversations that I've had around that is around, well, how can we do it safely? And it's around the hand washing and the 2 metre distance, and about having that open and frank conversation with their employer that says, I'm at risk, and therefore what can we put in place to make sure that I'm safe within the workplace. So it's about looking, and we give more individual advice on that, because obviously everybody has got a different, you know, sort of thing. I, for instance, got somebody who drives for a living. So it's about, you know, he's safe within his own little cab, but then it's when he drops his load off, when he gets to his destination, about the employer there making sure that there's that 2 metre distance and that there's hand washing facilities available, and that it, you know, he doesn't go into, well, the cafes aren't open, but you know, into the motorway cafes and things like that, just being extra careful. But it is more individual, but you're absolutely right, it's quite difficult to have the 2 layers.
Yeah, most definitely. Have you come across anything more recently in terms of people questioning more about like the medication with COPD? Because on the slide that I was just mentioning earlier, it says on the shielding, keep taking your medication. Have you found people are not taking the medication as frequently as they should be, or do you find there's been no questions around that?
I've personally not had any problems. I don't know about Lindsay. Have you had any problems? Is Lindsay there?
Yeah, can you hear me?
Yeah, I've just unmuted you.
All right. Yeah, no, I've not had any problems at all. People have been taking the medication as prescribed. There were some queries originally about whether patients that didn't have standby antibiotics should be given them. But if they weren't recommended before the pandemic, then they're not recommended now. So, but other than that, everybody's been doing what they should, not encountered any problems.
No, I have not had any. I think I've had it where families are still going out to collect medications, because obviously the delivery service is inundated. So although we're recommending when a patient is shielding, the family member that lives with them also limits the amount of times that they're going out. I've had problems where they've not been able to get deliveries from the pharmacy, but obviously the community hub is one place that we can send them to help them get the deliveries that way. But other than that, I've not had many problems, or people not wanting to take medication for any reason.
Yeah. I mean, it's difficult as well, because obviously the guidance is if somebody contracted COVID-19, they self-isolate for 7 days, and if somebody in their household did, then it's 14 days. So for somebody with COPD who is shielding, but then their partner, for example, catches COVID-19, it's also a case of how long does their partner then shield for, because obviously they're shielding already, those patients with COPD, and then the partner them who were going out and getting their medication for them, getting their food for them both. It's also a case of that and the struggle of that. Have you come across anybody who has been in that situation, and what advice did you give to them?
I think certainly from a carer who develops symptoms, then we're asking them within the home the best they can to isolate completely from the person that's shielding, and that's easier said than done, and to arrange it's almost like they don't exist. So what would we have done if they didn't live with that patient, about medication, about you know, sort of shopping and things like that. So it's almost about taking them out of the equation and getting them to isolate somewhere else in the house if they can. And then making sure that both of them actually are able to get supplies from an alternative source. So yes, it can pose a challenge. Yeah, we've not had a lot of it, fortunately. I'm touching wood as we speak.
That's good then, that's really good. Well, that's useful to know, because obviously we see and read what the government is given, and like you said, to act as if that person doesn't exist, and for them to shield in their away from somebody that they live with, that is really difficult to do. So
it's very difficult, because as Lindsay will agree as well, because both of us fairly early on developed symptoms and had to isolate within our own home from our families. So it's quite difficult if you're in the same household to be able to do that. So let alone if you've already got a long-standing condition like COPD that you're trying to deal with and need that support of family members. It's difficult for both parties. Definitely.
yeah, I can imagine. Yeah, are you both feeling okay now then?
I'm absolutely fine, and Lindsay, I think she's getting there, aren't you?
Yeah, I'm feeling better this week, thank you. Yeah. It's taken some time, hasn't it?
Oh, bless you. Well,
And I
that's
think we're both fit and healthy people. So if fit and healthy people, Lindsay more so than me, but if fit and healthy people, it's knocking sideways, you know, that's the risk to our patients. And this is what we never have to forget. You know, yes, it took me some shaking, but I'm here to tell tale. Our patients might not be quite so lucky, so we have to protect them the best way we can, definitely. And it's just about communicating that to the patient. It's for their benefit. I've had a conversation with a patient today that they've cancelled having a B12 injection, and obviously to a patient that's shielding, it's because of money, obviously. And I said, no, it's because it's to protect you, because if you have that injection, you've either got to go to surgery or somebody's got to come to you, and that's putting you at risk. So it's about protecting you and limiting interventions to absolutely necessary, and the government have decided that this is not an absolutely necessary thing. But it's a difficult concept for them to get their head round. It's the age group a lot of the time as well. They're very stoic and they've been used to just carrying on. So it's saying to them, it's okay to not go out. It's okay to sort of protect yourself.
yeah, definitely. I couldn't agree more with that, because you do see. I keep seeing, obviously, I'm not saying they have COPD. I am seeing a lot of the elderly generation getting up and going out, and at times you feel like saying, please just go home. I'll like, please just go home. So for anybody who is listening back to this, who has got the shielding letter and they have got COPD, just do the best you can. I know it's difficult, but it's not going to be forever. But just follow the guidance and shield to protect you. Because at the end of the day, it's you who's the most important in this, and it's you who's the most vulnerable. So we want to keep you safe. So overall, Dawn and Lindsay, is there any last comments or any more experiences you want to share?
No, I don't think so.
I don't think so either, no. I think
No?
covered a lot there. Yeah.
Brilliant. Well, I'm glad you're both well and keep safe. And thank you for anybody who is watching this back.